Hello, hello. Thank you all for joining us today. Welcome to SBN's Brain Awareness Week. My name is Dr. Kendra Anderson, and I have the absolute pleasure of introducing to you all our speaker for today. So, Dr. Dr. Scott, let's see here. Let, give me 1 second. All righty. All right. Dr. Scott, are you there? All right.
Yes.
Okay. Okay, I'm not sure if it's live yet. Let me see.
I think so. In
Oh,
my
it
screen, it
is.
says
Okay.
live. Yeah.
Okay. Oh, I'm sorry about that.
That's okay.
All right. Well, Dr. Shivley-Scott, if you'd like to unmute yourself and just give us a bit of background information about yourself as well as your talk that you'll be giving today.
Sure. Should I share my slides?
Sure.
Okay. I haven't used this platform before, so just bear with me here.
Okay.
Alrighty, here. Let's see. Share screen. Okay. Hopefully that works. I think hopefully everyone can see my slides.
Yep. There it
Oh,
goes.
yep. There you go. I can now see it on the. Okay, great. um, all right. So, yeah, so my name is Dr. Travis Shivley-Scott. I'm a clinical neuropsychologist at the Northern California VA healthcare system in Sacramento. And I work in a geriatrics neuropsychology clinic. And today I am here to present our first topic of Brain Awareness Week on brain health and physical wellness. What can neuropsychology do for your physical well-being? So it's an absolute pleasure to be here, and I will go ahead and get started. So I thought, because I'm presenting here with the Society for Black Neuropsychology, and of course, in our heading for the Brain Awareness Week, we do have neuropsychology, body, mind, and spirit. The word neuropsychology, I thought it'd be important to just define a little bit, especially for future speakers later this week. So, neuropsychology is defined as the study of the relationships between brain and behavior. And when we say the word study here, of course, it's not just an academic study. Although our speaker later in the week will be talking about research in neuropsychology. Neuropsychology is also a clinical field. It's also an aspect of healthcare, which hopefully I hope to clarify a little bit today with you all. And so, as a clinical neuropsychologist myself, one of the main things that I do is that I assess brain functioning through cognitive tests. And so these cognitive tests, some of you may be familiar with elements of these. These are paper and pencil tests, almost similar to those maybe you got in school. Unlike in school where you look at specific areas of academics like math or reading, we look at cognitive domains or areas of thinking. And we test areas like someone's memory, their attention and focus, their verbal abilities, and also problem solving, complex thinking, and so on. And what I do is, as a neuropsychologist, is I get information from these neuropsychological tests, and that gives me information about the integrity of the brain. So, unlike a radiologist or someone who maybe orders a brain scan and you maybe see a nice picture of the brain, almost like the one here, although probably in more detail, and maybe you can see in the picture of the brain like there maybe is a problem. What we do in neuropsychology is we really speak to the cognitive abilities, like what that problem translates to in terms of someone's basic functioning. So maybe they have a problem with memory. What does that look like to them? How bad is that problem with memory? That's what a neuropsychologist does. And so, again, just as I'm the first speaker here, just to kind of start us off and talk about the neuropsychology and the brain and well-being, I thought I would just talk about this a little bit more broadly, and then I'll get into specifically physical health and brain health. So, you see here that this figure on the right, these are just some of the areas. So not only does a neuropsychologist do these cognitive tests, but we also look at a person kind of from a holistic point of view. And that's what I think the speakers later in this week will also talk about when they talk about emotional and spiritual health and brain health. But in terms of what a neuropsychologist does, what the first thing we can get from that information from our neuropsych tests is that we can really describe a person's cognitive strengths and weaknesses. What are some of the areas of strength? What are they doing pretty well in? And what are some of those problems that's probably one of the reasons that we're actually going to see them. And then with those strengths and weaknesses, we can better understand, diagnose, and at best maybe even predict their future cognitive abilities. And so what this looks like is, we can not only determine what, if any, thinking problems may be present, but we can really, at best, maybe we can even diagnose certain medical or neurological conditions. For instance, as I mentioned, I'm a clinical neuropsychologist who works in geriatrics, and one of the most common diseases of aging is dementia. We call it major neurocognitive disorder. And so with dementia, really, in order to diagnose it, you need to see certain changes and declines in thinking, in cognition. And so that's, again, where we can really play a key role in the whole medical picture about answering, from a cognitive standpoint, how someone's doing in terms of their health. But not only can we just diagnose things, I mean, that's only an aspect of what we do. We can also recommend certain strategies, cognitive strategies to people, assist other disciplines in the bigger medical picture with how this particular person may be better managed. And at best, with certain forms of neuropsychology, for instance, very common in individuals who assess people with brain injuries, like traumatic brain injuries, we can even provide some treatments to kind of remediating and rehabilitating lost cognition. So, for instance, someone with a traumatic brain injury could see a cognitive a cog rehab specialist, cognitive rehabilitation specialist, and get some strategies and even potentially recover some of the lost aspects of cognition. Of course, in certain things like dementia, we may not be able to do that. And so, what we can do, at least what I do on a more regular basis, is I can recommend strategies based on how someone's currently functioning from a cognitive standpoint. What kind of things could be helpful for them. And then another big piece is that we really provide a bigger picture of how, based on how someone's doing from a cognitive perspective, how they may be able to actually function in daily life and what their daily living skills might actually look like. So, can they manage their own medication by themselves? Can they cook for themselves? Can they shop for themselves? And so on and so forth. And just to kind of, again, illustrate with this image on the right here, how this kind of maps onto our topics is, I'll be talking really about the physical piece, the cognition piece, and also some of the more basic physical health functions that relate to brain health. On Wednesday, we'll be talking about emotional health. We also look at emotional functioning and personality as neuropsychologists. And then I think in terms of spiritual health, what really makes someone, go in life, and what really makes someone, make someone's life meaningful. What are the functional pieces? What are typical daily activities they do? I think that really speaks to spiritual health. And of course, we'll talk more about emotional and spiritual health and brain health later this week. But focusing on my particular area on physical health strategies, I wanted to spend the rest of the time of this presentation taking you through some very specific physical health strategies that relate to brain health. And these are just among some offerings from the National Institute on Aging, Healthy Aging Physical Tips. And these are also things that I incorporate in my practice in terms of talking to patients who I see, giving them recommendations. One big piece, and these two are kind of combined, is exercise and physical activity, and also healthy eating. What we know is that certain medical conditions like hypertension, high cholesterol, diabetes, especially type 2 diabetes. These are often related to poor eating habits, or maybe not getting enough exercise and not getting enough activity and kind of getting out. And so one really important thing to do is to get the recommended exercise per day, outlined by your doctor and just in general with what's recommended. And also to have a healthy diet. And specifically, what we know is what's healthy for the heart is healthy for the brain. So if you eat a heart healthy diet, as outlined by the cardiology and the American Heart Association, that's the word I was looking for. Then we know that those kind of diets, Mediterranean diets and diets that really promote reducing blood pressure and high cholesterol, they lead to overall not only healthier outcomes in terms of longevity, but also better brain health. Sleep is also very important. We know that just getting enough sleep, getting your 7 to 8 hours of recommended sleep per night, results in not only a longer life, but also better overall cognition in areas of memory and complex thinking. And then also, it's not only just about the amount of sleep, but the quality of sleep. We know that certain sleep conditions like sleep apnea, which is these periods of hypoxic events that can occur in the night that lead to someone not getting oxygen they need to in the middle of the night. This is like the snoring. You may know someone who has this constant snoring. And if that's not treated and a person is not, getting adequate oxygen in a given night, that can lead to poor memory and complex thinking and other cognitive skills. And we know that treating that with something like a CPAP device can really promote overall brain health. And then reducing substance use is huge. Not just your obvious substances to avoid like cocaine and heroin and things like that. Obviously, those are bad for brain health and physical health. But other substances, like making sure you limit your alcohol use, either avoiding it entirely, or if you do drink, drinking in moderation, really. And we know that heavy alcohol use and prolonged, frequent alcohol use leads to poor cognitive outcomes and poor physical health. Things like tobacco relate again to this idea of kind of vascular health and the blood flow from your heart to the brain. If you smoke a lot of cigarettes or are frequently smoking, or then typically that can lead to poor vascular health. It can lead to it put you at risk for things like stroke and other medical conditions that can lead to poor cognition. So of course, eliminating cigarette smoking can basically reduce you back to a more typical level in terms of that. And then keeping up with doctor's visits, that's really huge. So doing this by preventative care, making sure you go in regularly to identify any of these conditions like high cholesterol, hypertension, and so on. But also, making sure you follow your doctor's recommendations and getting the specialty care, and in some cases, seeing a neuropsychologist if, especially as you age and if your cognition is suspect, definitely getting in and getting evaluated and determining if there may be certain weaknesses or certain conditions that may be underlying poor cognition. That's really huge as well. So in summary, neuropsychology can promote physical, emotional, and spiritual health. Neuropsychology can be useful in identifying and describing and managing various medical and neurological conditions, such as dementia, which I described. And specific physical health strategies exist, which can promote brain health. And that's the strategies that I provided on the previous slide. So with that, I'll pass it back and I will wrap up. Let me see if I can exit this. And let's see if I can stop sharing my screen. Okay, there we go.
All right. Thank you so much for that wonderful overview of the intersection between our brain health and our cognitive health. If you all are out there watching, please go ahead and feel free to type any questions, comments that you have in the chat, and I will place them up for everyone to see, or I'll read them out to Dr. Shivley-Scott for you to answer. We'll give it just a few minutes. Oh, good question. So, is it possible to reverse dementia? Great question.
Great. Okay, I'll start with that one. Yeah, that's a really good question. There are some forms of more like, again, reversible dementia. There are certain acute conditions that can develop suddenly and result in um, uh, really poor cognition all of a sudden. Um, those are typically diagnosed through various laboratory panels and looking at different levels of things in your body that can relate to, again, this kind of abrupt presentation of dementia symptoms where you're having really poor cognition. More typically, in the case of certain dementias, really common ones like Alzheimer's disease and Parkinson's and things like that, it's really more about managing and catching it early and managing the symptoms, and really doing some of the tips, that again that I've outlined here, and other things to limit the decline, the rate of decline. And we also know that certain individuals who just in life are, they do some of these things, are more physically active, and as we'll talk later in the week, they have better individuals who have better emotional health and are doing things to stimulate their brain over time. They're less likely to actually show signs of dementia too. So you may have certain changes in the brain, but actually not present with like the clinical syndrome of dementia, those actual cognitive symptoms. So there's also that as well. There's things you can do even before you get dementia to prevent yourself from getting it.
Wonderful. Thank you for that. You mentioned that neuropsychologists can diagnose dementia. Is that all that neuropsychologists do?
A good question. Yeah, and so we're talking a lot about dementia here, and that's one of the reasons is because I that's the population I see. Dementia is often identified more often than not, as you age, and especially with the more common ones like Alzheimer's disease, 65 and older later in life. However, no, neuropsychologists can do much more. Of course, I can be biased and work with older adults, but of course, there's pediatric neuropsychologists. There's neuropsychologists who can identify different neurological and medical conditions that affect cognition in childhood. And really, anyone any condition that has a cognitive component where there could be decline in someone's thinking abilities can be assisted by a neuropsychologist. That can be really at any age and really any condition that may have cognitive symptoms. A neuropsychologist can definitely play a key role.
Wonderful, wonderful. Thank you for that. I have another question here. Excellent question. Are there daily brain exercises that you recommend?
Very good question. Yeah. So, and I don't know how much this will be talked about in some of the other talks, but I'll try to be brief here so I can still give others opportunities to address this content. But yeah, there are definitely things that we know can be helpful for kind of, again, maintaining that kind of brain health and exercising your brain. And it really isn't anything too complex. You don't necessarily need some of these brain apps and some of these companies that do this really hardcore like cognitive improvement and things like that. It can be as simple as doing crosswords, Sudoku, even just reading. Those kind of activities we really know and have been linked um, to really kind of helping to maintain brain health at the level it's at, and then also preventing further decline. Anything that really exercises the brain. So if doing certain brain apps or brain games are fun and will encourage you to do it more often, certainly they won't hurt. But you can even do more simple things too that anyone can access, like reading or crosswords and things like that too.
Thank you so much. Oh, what another wonderful question we have from the community. Uh, the esteemed Dr. Bird. uh, she says, happy to be here and see Dr. Shivley-Scott educate the community. What types of things can parents of young children who play sports do to support emerging brain health? Ooh, excellent question.
Very good question. I think hopefully it'll stay up there. And thank you, Dr. Bird. It's good to see you here. Yeah, that's a really good question. So yeah, in terms of especially with the sports and brain health, I think if we're kind of maybe gearing towards not just the things that I mentioned in terms of, different brain exercises and things like that, but more related to any kind of potential dangers, or we're talking contact sports and things like that. I think there's a few pieces that would be just important to consider. Obviously, it would start with just kind of being educated about what safety measures are in place, and what the particular sport may involve in terms of the risk to things like head injuries. Some sports are going to be probably by definition just more risky in terms of and resulting in injuries, and especially brain injuries. Things like really heavy contact sports, like football, tackling, things like that. It's going to be um, more risky from that sense. But if there are good supports in place, and good safety measures, there can at least be some limitations to that. And it's obviously an individual decision in terms of what a parent would allow or feel comfortable with their child participating in. But certainly, just considering and thinking about what safety measures are in place, what is the potential likelihood of any kind of adverse brain effects to happen, and again, just asking personally, what do you feel comfortable with actually accepting in terms of the level of risk to your child. It's a really good question and topic that I would definitely defer to other, obviously, pediatric neuropsychologists who study this area very specifically for more details. But I think that's what I can say on the topic.
Thank you, thank you. Earlier you mentioned um, that keeping up with doctor's visits as one of the brain health strategies. However, some individuals, especially those from disadvantaged backgrounds, may have quite a bit of difficulty keeping up with regular doctor's appointments. What can be done for these individuals in particular?
That's also a really good question, and another one that there's no easy answer. There's a lot of these. There's not like a really simple one single answer. But I think with something like that really it's there's several layers to the question. There's obviously at a more systemic point, what kinds of things maybe need to change to give better access to certain underserved individuals, to get access to those doctor's visits, from a very kind of systematic, kind of policy level. That's definitely a concern. And then more at an individual basis, it's based on what resources the person has access to, what kinds of things are realistic for them to be able to do. So maybe that you can only get in and see a doctor for once a year. But even that is still better than nothing. And then at that point, it's just making sure you utilize the visit as best as possible, making sure you ask questions you have, and you speak up, and if you feel like you're having troubles in certain areas, be it brain health or physical health, you make sure that the doctor is aware of that. Then you're more likely to at least get connected to other services and specialties. And if it is something related to your cognition, you're more likely to get connected to someone who can assess cognition. But of course, it really does start at the level of making sure that these individuals have the equitable access, in terms of doctors' visits that are close by, that obviously in terms of the costs and things like that as well. But it's a question that can't be answered simply. It's gonna be a short-term solution and a long-term solution. What's realistic now versus like ideally at some point.
Yeah, thank you for breaking that down for us. So I noticed that you did mention taking medication as a brain health strategy. Are there certain medicines that can improve cognition?
Yeah, another good question. It's interesting. I know that there are probably definitely medicines out there that claim to be brain boosters and cognitive enhancers, and to be honest, I don't know everything that is out there, but I've definitely seen them. I've had patients that have come in and said, I got this medication supposed to improve cognition. Definitely you'd want to obviously check with your doctor if those things are going to be safe for you to take. But in general, uh, uh, aside from certain medicines that are prescribed to individuals who have dementia, which are designed to kind of prevent the decline of cognition long term. They're not meant to reverse dementia, but they can at least maybe slow some of the brain changes. There are certain medicines for dementia like that. I think they're called, anticholinesterase inhibitors, or like Namenda or Aricept and things like that. Those medications do exist and they are regularly prescribed. But apart from that, and maybe someone who doesn't have dementia but just trying to boost their brain skills, I would really again defer back to some of those brain strategies that we talked about, and some of those exercises that we talked about, more so than maybe some of these other medication options. I don't want to sort of say that the medicines would hurt, but I think the person may get more out of some of the strategies where they can actually make behavioral changes than trying to just take some pill to quickly boost their cognition.
Excellent, excellent. So let's say I have a concern, or I just wanted to do a check in about how my cognition is going. How do I find a good neuropsychologist?
That's a really good question. So, I mean, beyond the kind of maybe obvious of just doing a Google search and just trying to find what's near your area, or using whatever resource you have through your health insurance, or through whatever search providers that you can be connected to through what your coverage is. A really good way that you can actually get connected to a board certified neuropsychologist. And I should specify that board certification is kind of our way to show specialization in our fields, kind of like the medicines, medical boards have their own boards. We in neuropsychology have what's called a board certified neuropsychologist. They can even be more additionally certified in pediatric neuropsychology if they have specialty with kids. You can actually do a search for a board certified neuropsychologist through the AACN, the American Academy of Clinical Neuropsychology. They have a directory where anyone can just go in. You don't have to log in or anything. You can just go in there and look by state, and I think they even have it maybe broken down by languages that are spoken. Even I think we even have Canada. This is like, you can even look at provinces, and again they have that pediatric specialty too, where you can actually see, and if they're registered there, then certainly you can take a peek and see if there's a board certified neuropsychologist in your area.
Great, wonderful. And I know our organization, SBN, we're working to grow our database of neuropsychologists on our website as well.
Hmm.
Um,
Yep,
Dr.
that as well,
Harley,
definitely.
yeah, apologize for my son in the background. How can one work on improving sleep to support brain health?
Great, good question. Yeah, so basically, what can you do to really improve sleep to support brain health? So as I mentioned, duration and quality is really important. So it would be things like, if you aren't getting good enough sleep, if you're waking up frequently, or just not getting enough hours, or again, like you have a condition that's impeding like regular long sleep, like apnea or insomnia, it would be definitely um, treating those underlying conditions. So really, again, working closely with your doctor and the different specialties that exist out there for sleep medicine, to make sure those things are treated. That's one of the main ways, is to make sure that those things are treated. So you are getting enough sleep, and you don't have any conditions that are either causing you to wake up or just not get a good enough quality of sleep. That's one of the kind of main ways to improve sleep, and that, of course, as Dr. Harley said, would support brain health, because we know that individuals who have poor sleep really don't, unfortunately, have as good of cognition.
All right, thank you for that. We have another question from the community. What's the deal with superfield foods? Can people really eat something that boosts their brain health?
Yeah, it's another good question, and that kind of goes again, I think, back to the diet piece. And I'm definitely not a nutritionist, and so I would defer to those folks for real specific recommendations and tips. But certainly, those are definitely out there. There are certain types of foods that have been known to, again, kind of, as I kind of mentioned, heart healthy, or even specific like superfoods, as Dr. Ray said. that can, kind of promote cognition. I would say again, really, as long as the type of food is, recommended by a doctor or a nutritionist, it definitely doesn't hurt, and some foods may be even better than others at improving cognition, or I guess at least it's maintaining cognition. There probably isn't a food that exists there that's gonna, just like with the medication thing, that's gonna completely solve cognitive problems, or drastically improve cognition. But certainly, most foods like superfoods won't hurt, and at best they can, at least maintain positive health and maintain cognition.
Perfect. So, our Dr. Courtney Ray has joined us, and she's going to come on and finish some of these interview questions as well.
Hi, everyone. I'm just so glad that I get a chance to talk with you guys. And thank you so much, Dr. Anderson, for just this presentation and the interviewing. And thank you, Dr. Shivley-Scott, for giving us such an in-depth look at what are some things we could do for our physical health that will boost our cognitive health. I know that there are different questions that we have in the chat that I do want to look at really quick. Only a few more, since we are going to end soon. We don't want to hold the community. But another question here is, are there things at different ages that people need to do? Is there something different from if you are a young child versus if you're middle aged versus when you're older, that are the things that you should do kind of at every age?
That's a good question. Yeah, I'm trying to think here as you mentioned it. I would say, I think I'll start by saying, one. I think one of the things that comes to my mind right away is, in terms of, developmentally through that trajectory. What we know is that educational quality and kind of quantity is really key in, contributing to that kind of cognitive reserve that someone will have, that can stave off things like dementia, and certain neurodegenerative conditions like Alzheimer's disease, where even if you say have some of the brain changes, you're less likely to actually show the actual memory changes that affect daily life. We know that people who go through school, do well in school, go to good schools as much as possible, and continue on with their education. Go beyond just middle school, high school, even college. If you even go beyond that, and the more kind of education, the better quality. Really, that is one thing that can lead to better overall cognitive health down the line, and be more resilient to any kind of cognitive changes. And then at the other stages, it's also really just about, again, some of the other things to talk about. So once you're done with your schooling, there's also the occupational piece related to that. There's again, the more complex job, the more kind of cognitively stimulating job, you're again more likely to have resilient cognition, and less likely to experience cognitive decline later. And then the things we had talked about in terms of maintaining diet, exercise, good physical health, again, really tying physical health to brain health, as we've been doing today. That's really key in preventing any kind of future cognitive declines, because a lot of the areas that affect you physically and affect your physical health, be it kidney disease, vascular disease, anything like that, that affects cognition. A lot of those things affect cognition, and then so that's another way, as you get older, really making sure, if you're more at risk for things like diabetes, hypertension as you age, to get those diet and exercise and things under control.
And so, what age should people kind of start thinking about some of those things that you mentioned?
Yeah, I mean, it's honestly never too early, because developing those kind of habits at a younger age means you're more likely to maintain those throughout life. So if you kind of had to break it down a little bit, it's if there's kind of one priority thing, maybe earlier in life, really making sure for parents and things like that, making sure that educational quality is really good, and then also the person's not just being educated, but doing well and staying stimulated, staying cognitively active, being curious. That would be really helpful at those ages. And then as you start to transition to the workforce, not just doing kind of some repetitive, boring job, but doing something you enjoy and that's kind of stimulating to you, makes you think. More people the more you engage in things like that, that'll be more helpful. And then as you move on to retirement age, just not just necessarily being retired and doing nothing, but continuing to stay active. If that just means doing crosswords or Sudokus, that's fine. But even doing other things, engaging in other projects that keeps your brain stimulated, that'll really help long term as well. So the different stages of life.
Awesome. Awesome. I see that we have another question from Jasmine Summers, but Jasmine, your question is, are there specific neuropsychological interventions that target emotional health, perhaps outside of SSRIs? But Jasmine,
yeah.
Emotional health is what we will be talking about on Wednesday. So
it's a great transitional question.
You have to tune in and hold that question for our presenter on Tuesday. We're going to have Dr. Kiera Morrow come, and she's going to talk to us about emotional health and cognitive health. So you don't want to miss it. Hold your question. Be here the same time, and we will talk about that and other kind of mental health and emotional health and wellness, and how that ties into brain health. But I guess that actually is a great segue to say thank you so much, Dr. Shivley-Scott, for your time and for being here for our first installment of Brain Awareness Week, and being willing to come and to talk to the community and helping us to see just the importance of physical health and how it relates to our brain.
Thank you. Yeah, it was really great to be here, and I look forward to the rest of the presentations this week. And definitely, definitely a good question there for the emotional. I wish I could cover everything in this talk, but we got to give the other speakers an opportunity as well. And really looking forward to those talks. Thank you.
Absolutely, absolutely. Well, thank you so much, Dr. Shivley-Scott. This, like I said, is the first night of our Brain Awareness Week. We will be having presentations not just tonight, but also Wednesday, Friday, and Saturday at the same time. If you're watching this on a rebroadcast, we're inviting you to look through the playlist and watch all of those presentations. On Wednesday, we will have Dr. Kiera Morrow talking about our brain health and emotional health. On Friday night, I'll be talking about brain health and spirituality. And on Saturday night, we're going to have Dr. Valencia Montgomery talking about the ability for the community to be involved in brain research. So you don't want to miss any of those nights. Thank you so much for coming out. We will always try to make sure that we're answering those questions. So come with the questions on the evenings that we have Wednesday, Friday, and Saturday, and we will get to you. Have a good night, everyone.